Yes, welcome to all. I like to share PowerPoint presentation. Yesterday we had been learned that health versus society. Last section I was emphasized that the infectious diseases have been determined by society. Hence, society can be controlled every factors. What are the factors? Look at this: biological factors, nutrient factors, physical, chemical, mechanical. So one of the theory, traditional theory. Today we have been going to explain about environmental factors. Before I would like to evaluate previous class. Shally, Silpa absent today. Yes, can you define disorders? What do you mean by disorders?
Disorder means functional abnormality or disturbance.
Or can you list types of disorders?
And types are mental disorders, physical
Excellent,
disorders,
excellent.
genetic disorders, emotional disorders.
Excellent answer. Thank you. Hence, today start with this. Environmental factors, physical environment, non-living things, air, water, soil, mainly climate. Biological environment, non-living things, already we have discussed, microorganism, bacteria, virus, plant, fungus, and cattle, animals, etc. Then psychosocial environment. So this is a fundamental. We are every individual having their own individuality, psychology. We can solve their own problems. So this environment controlled by we, social. If we have good behaviors and maintain hygiene, personal hygiene, mainly mental hygiene, to prevent and control the infectious diseases. Next section, health care. Next concept. Levels of health care: primary, secondary, tertiary. Primary means For example, PHC, primary health centers. Secondary, district level hospitals. Tertiary, teaching hospital, research. So these three levels of healthcare facilities available in India. Then relationship between sociology and health. Society. So these are the components of society: individual, family, religion, education, economic institution, determine job, occupation, community, social groups, welfare organizations, political system, and ecosystem. We are individuals, interact with these all the components of society, okay? Then health, physical health, mental health, and social well-being. Then we are going to detail about relation between each components. For example, individual and health, family versus health. First, individual. Individual factors including bio, psycho, social factors. Biological factors means genetic factor. Psychological features mean their personality, their perception. Then social factors, their belief, religion, belief, values, occupation, their families. So these are the individual, their own. Such as genetic, neuroendocrinal, personality. For example, some diseases ascribed from generation to generation through genes. Next point, negative attitude is a psychological feature of a person towards self, cause stress, leads to physical and mental illness. Then family and health. Is family determine health of people? Yes. Familial factors, type of family, culture of family, norms, habit, members, and how many members in the family. Example, food habits cause diseases, and standardized culture leads to communicable as well as non-communicable diseases. Then religion versus health. Religious elements, mainly types, belief is very important. Worship. Then attitude, whether positive attitude towards religion or negative. Example, negative attitude towards religion cause first mental illness, which leads to physical disorders and physical illness, and also cause social disabilities. Then education and health. Educated people experience good health status than illiterate due to alertness and awareness regarding diseases. Then economic and health. high economic status, experience good health status, the people easy to access the healthcare services. Then low economic status, experiencing poor health status comparatively. Mainly the economic status directly linked with education. Then occupation. The economic institutions determine the job of the individual in the society, types of job, position of job, whether higher level of job or low grade job. Then health and safety in workplace, which is very important. Health and safety. For example, occupational hazards in hospital concern, nosocomial infection, these we are hospital professionals need to be away from hazards. For example, this prevent nosocomial infections. Then community and health. Community factors such as ecology of community. Ecology means environment. Example, urban people having more health status than rural people. The reason is that the rural people having standard of living, mainly they have good educational status and economic status. Then availability of healthcare services, which is other key. In city, mainly rural, urban means city people having more access to healthcare service, but rural people less access due to facilities availability. Then social groups and health. Group factors such as group selectiveness. For example, friends. If a person select positive friendship or positive groups, that person experience good health status. Look at this, negative groups. Example, alcoholic groups. Should be experience mental or physical illness or social disability they experience. So group choosiness is essential, is directly linked with health status of individuals. Then group dynamics, changes in the groups, mainly primary group, familial groups, etc. Influence health status of people. Then voluntary and welfare organizations, in international terminology, NGOs, non-governmental organization, aim to promote health and education. More welfare organization in the society import health status of people. As we know that in India, maximum of hospitals or healthcare is only NGOs, non-governmental organizations, and private, which is determine health status of people in India. Then political system. Government is a pivotal agent, institution, determine health status, people. Mainly healthcare policies, program aim to promote health, prevents the diseases, empower physical, mental and social well-being of people. Next, ecosystem and health. As we have discussed in theory, in epidemiological triad, biological, physical, socio-psychological environment. The fact is that society only determines the person's mind. The mind determines it to solve the problems of the social environment, which help to control biological and physical environment. Example, negative and polluted environment affect the society, then which affect the mind of the people. Stress, depression, which is directly linked with diseases, communicable diseases as well as non-communicable diseases. For example, stress, which leads to reduce the immunity power, which is opportunistic infections. So environment is a fundamental one. If a person interact with the environment friendly need to promote health. So which is a fact. The health have been determined every components of society. So when we interact with any component of society, should we think about it. The mainly nursing concern which help us. Next section we are going to discuss that. Physical health and society. Physical health determines society. Determined by familial factors, religious factors, educational, economic and occupational. Then undesirable culture cause physical illness. For example, food culture, food habits. Then mental health and society. Cause root of mental illness, society or social factors. Familial, religious, educational, economic, political, environmental. Example, negative attitude towards religion, religious factors, which means religious belief, negative belief towards religion. Cause stress, depression, and other mental illness, which is cause root of physical illness. Non-communicable as well as communicable diseases. Then social health and society. Social well-being always determined by social factors. Person is not fluently interact with every parts of society leads to range of social disorders or social disabilities such as familial disorganization, religious disabilities, economic disabilities, and civil disabilities, which directly influence or affect health status of people. Directly affect physical, mental, social well-being. Next section, nursing. As we know that fact is that health is always depends on the society. So study of society is fundamental for nursing. Detail going on. What is mean by nursing? Society versus nursing. Define nursing. Autonomous, collaborative care of individuals. Collaborative means, autonomous means individual decision. Every nurse take their own decision. Nursing decision making. Collaborative, collaborate with other healthcare professionals, doctors and allied health professionals, all ages, families, groups, communities, sick as well as well, not only sick, as well as well, maintaining the health. All setting, everywhere. All setting means everywhere. Include promotion, prevention, care of ill, disabled, dying people, advocacy. Advocacy means advice. Promotion of safe environment, counseling too. Environmental modification or safe environment. Research. Participation in shaping health policy in patient and health system management. Education. Also key nursing role. Shaping health policy means participate with government, okay? Participate with government to formulate healthcare policies. Management, nursing management. Education, nursing education. So this is a key definition by ICN, International Council for Nursing. Relationship between sociology and nursing will be next class, okay? Relationship between sociology and nursing we will learn next class.